Are you worried about gastroparesis while taking semaglutide? In this video, I'm going to explain gastroparesis and how to prevent it. So simply put, gastroparesis is halting your gastric system. It is completely shutting it down. Nothing can get through and everything wants to get out. That is the simplest way to explain it. So what happens when you're taking semaglutide, tirzepatide? It is slowing your digestion down naturally. That's what it's doing. That's how it's helping you lose weight. But if you take too much too quick, what it's going to do is just screech halt to shut your gastric system completely down. It will not let anything go through your stomach at all. So anything, water, food, all of it just stops. Basically, you can think about your esophagus just causing it to completely shut down. When I did this to myself in the very beginning, I just took the top dose, first thing out the gate. That's what I took. And my esophagus was just completely shut. So anything even a sip of water, it would not pass my esophagus into my stomach. And nothing can sit in your esophagus for very long. So I was heaving it back up. Then what that does is that's going to cause dehydration. That's going to cause you not to move your bowels. That's going to cause you to really become pretty sick. You become lightheaded. You become more nauseous. You vomit more. So you can become very quickly very ill. You stand up, you're dizzy. That's called orthostatic hypotension. So what you need to do is immediately go to the hospital. You can probably withstand vomiting or, throwing up half a day. But if you're not urinating at all within 8 hours, you really need to go get IV fluids. They can give you some medications to help stop and slow down that vomiting. But if you're not able to get any fluids in at all, you really need to seek medical attention immediately. So gastroparesis is caused by the medications not being dosed properly. So when your provider is trying to tell you that you need to only take this much, listen to them. If you're not sure, if you're not receiving syringes that are pre-filled and you're getting a vial, if you're not sure what you're drawing up, you need to ask questions. It's very, very important that you have somebody that you could talk to ask those questions. I'm available. You can put the messages in DMs and you can ask me. I will absolutely answer your questions for you, but you need to make sure that you're asking the provider that you're paying to get these medications from as well. Give the medication as prescribed and do not self-medicate yourself or dose yourself. Make sure that you're asking the right questions. Then, if you are giving the right doses and you're still having a lot of vomiting from it, then this medication may not be for you. Or you can go back down a dose. That's important as well. Go back down a dose and stay at that dose. If that's working for you, stay there. You are able to work with your provider to find out what's the proper dose for you. So if you have any questions, please ask in the messages. I will be more than happy to ask them for you. Thank you and have a wonderful day.